Hi, Don here. Welcome to Podiatry Practice Mastery, where we're helping you get your practice to the $1 million mark and beyond. My most valuable patient of the day here, this was a recording for a Friday. It was a patient, he was number 3 out of 4 for Shockwave. He had a second met fracture due to a hiking injury, and he's been doing those every 72 hours. So this is a patient. As I was talking to him a little bit more, kind of an entrepreneurial guy. He used to run a lot of Remax offices. These are type of patients that tend to want to pay for speed. And I think there's a really an added benefit for us when we're treating patients to offer them speed at a price, and they're willing to do that. So he's wanting to get back, like he's barely a week and a half in. He's already like wanting to know if he can go back hiking. I'm like, it's going to speed it up a little bit, but it's not going to speed it up that quick. But he is starting to feel better. So for like some stress fracture or stress fractures or fractures that patients want to get better and back to their activity quicker, I think offering Shockwave can be a benefit to them. So that was really the MVP patient. The rest of the day was not that exciting, and as I'm looking at it, I'm going to talk about actually some negative things that happened for me. I had a matrix follow-up, so I'm intending to do matrix follow-ups in my 10-minute slots. So what happens is when patients come in for a matrix, I do a 3-week follow-up. I know some doctors don't do any follow-ups. I used to do a 2-week and a 4-week. Now I do one at 3 weeks. But the problem is it filled up that 10-minute slot, and there was another 20-minute slot that was there, but that one didn't get filled. So to me, it seemed kind of like a waste. That more be a patient scheduling problem. Another problem of the day was they scheduled some nail care patients as well. During that time, I don't know how they got in there. They're usually done on Friday mornings. That's kind of how we restrict things. But there was a nail care, and there was another nail care. One came in for I did like a partial nail avulsion, a 78-year-old, and one's a 92-year-old for nail care. I think maybe the staff were just nice, or they didn't know the protocol. But most of them should know the protocol. But somehow they sneak in. So I'm just kind of sharing these could have been better, valuable patients, but this one wasn't. And there was another routine as well. And they may have had some other things like this. One of these routines, they had like a hematoma under the hallux, and they were concerned about fungus and things like that. Another patient was a right bunion that came in. She had pain, and we talked about shoes, anatomic shoes. I spend a lot of time talking about shoes. I tend to recommend ultras, topos, and then we sell LEMS in our office. I am not the great at selling the LEMS. My partner's a little bit better. Not exactly sure why. I think a lot of times when we get busy, I'm worried about overbearing the staff. But I wear LEMS all day long, and I think LEMS work well. And I think another thing is we don't have a huge selection. I think we have like just a couple of colors and not a huge amount of sizes, and it's not the most convenient to buy them for the patients. But when they do get them, it's an okay revenue producer. But I did do an injection as well because of her pain that she was having in there, and I looked at x-rays with her. Another patient that came in for a second met fracture, feeling better. I'm going to see them back in 1 month because they're not totally better, and I talked about kind of doing an MRI if it continues to be painful. And then the other patient was a posterior tibial tendon pain. This patient I've seen a few times. Now, this is an interesting patient. We have quite a few patients here that have Medicare, and they have Mass Health. So Mass Health is like the Medicaid, and we don't take Medicaid here in our office. So what happens with these patients is they will pay the 20% out of pocket. So for a lot of patients that we see, they value us enough to want to be seen and pay the 20%. And so this is something I think you have to be aware of. If you have a good product, patients a lot of times will pay for speed. So for example, to see us, we can get them in within the week. A lot of the other doctors that might take their insurance might take 2 or 3 months to see them. So I think one benefit of having a system to get people in fast can be that. This patient, they had bilateral x-rays, they had bilateral ultrasounds as well to look at the posterior tibial tendon, and I talked to them about doing a Shockwave. So this patient, they had a cortisone injection last time in that region. And another thing about like patients that, for example, didn't want the Shockwave, like what's the other option? The other option is to make them an AFO. So I talked about making an AFO through hanger, and then I also talked about doing Shockwave, but Shockwave was a little too expensive for this patient. The rest of the morning patients were my Friday morning, and I want to say we've been having this nail tech for about 6 months now. It was a long ramp up, but she was a really big win for the office. Her name is Marjorie. She has her own nail clinic, but she doesn't really see many clients in the morning, so she helps us out 3 days. One of my colleagues doesn't really utilize her that well. Because he doesn't really see much routine care, so it's just kind of she's like hanging out there. My other buddy, he uses her pretty well, but I utilize her the most, basically, because I have patients every 10 minutes, and then she also has her own schedule of like 6 or 7 patients. So when she's working with me, she's like doing all the nails now. She can do even the real thick ones. She also is getting more comfortable with calluses. Now the calluses, I am monitoring her. I am observing her. I'm teaching her about like what's a pre-ulcerative callus, what's the anatomy going on here. So she feels more comfortable, and also more comfortable because I'm there. But I feel like after 6 months now she's getting a little bit better with calluses. It took her a long time. It took her to especially do the real thick toenails. She still struggles a little bit with getting those down. But I really feel like this was a big win for our practice to do this type of and it was a big addition to our practice. And I think that possibly the same, like, okay, the same confidence now we have in her doing the nails, could we also find someone that could do the shockwaves? Like, I think we could, and I think it's going to take training. I think it's going to take time them shadowing us. But I think in the same way, let's say I schedule 6 shockwaves, and I do the first and I do the 6th, but the other 4 in between, if I'm there, I can stop in, say hi, answer any questions, and then they can do the shockwave. I think if we have the amount of space to do that, I think that would be the next logical step that would then free up more time for more slots. Right now we're not doing that because there's not a super amount of demand. So right now the focus is on building up that demand for our practice. I want to share 2 things. One is the urgent care. We have an urgent care webpage, so if you want to go to our website, you can take a look at centralmasspodiatry.com. There's an urgent care thing. You can kind of see how we're kind of focusing on urgent care. And then we're also doing some blog posts. If you look at the blogs, you can look at the blog posts posting back to the urgent care. And we've been having many more patients come in for the urgent care because when we're trying to attract patients, I'm really not interested in patients that want a discount. I'm wanting patients that want quick appointments. Most people around might get in 2 or 3 weeks. We're able to get in within the week because of our new doctor. So the focus is on getting them in with that urgent care. The next step is to kind of, okay, how can we now push ads to that urgent care, or how can we then talk about that urgent care to other centers of influence so that they can get patients in. In the past, my focus has been on like getting one diagnosis, like plantar fasciitis or ingrown toenails. But I think maybe a more elegant method would be like, okay, urgent care, whatever your urgent need is, we can get you in. It's a little bit better, and it's a way to fill up this other doctor's schedule. That's my main focus right now, is like, how can I do this? One idea I've gotten from one of my favorite guys that I follow online, Alex Hormozi. Just so you know, he also has a ChatGPT. So if you guys use ChatGPT, you can look up, there's like chats from different people. He has one, and it just really good questions if you want to talk about marketing, if you want to put in developing your dream offer for patients, things like that. That's the ChatGPT focus. Like it's on your little ChatGPT thing. Like it's low expense to do that. But he kind of guides you on how to make these irresistible offers. And so one would be doing that, and then next would be, okay, how can I send ads to that page to get people more people there, because we've kind of getting as many as we can organically, and we still have a lot of spots available for this new doctor. So my thought would be, and what he recommends is, okay, you do these YouTube shorts, you take the best YouTube shorts, and then you turn them and you put a call to action, like, hey, if you have an urgent care need, come visit our office. So that's kind of what I'm focusing on right now. If you want to work on getting your practice to the $1 million mark and beyond, I put some resources on my website, podiatrypracticemastery.com. There is like a masterclass there where I kind of give it all away. It's in a structured format. You just put your email in there. You get all the videos, like it's called my $1 Million Blueprint, something I put together. Do that. Reach out to me. Let me know how you like it, how it's kind of helping your practice. I'd love to hear back from you. Okay, thanks.